On this episode of Paramedics...
Is he in water?
Hello? No.
Can this scared old man survive after being trapped in a bathtub for days?
You right down there, John?
We just want to get you out safely, mate.
She just feels so hot on her head.
Cam is called out to a tiny patient in trouble.
For any parent, this would be a terrifying situation. She's lying there, possibly unconscious.
Hey, little miss.
Do you want me?
And Nat finds an admirer.
I love you. You love me?
Wow, that's very quick.
He loves me.
Emergency services. Go ahead, caller.
I've got a gentleman stuck in a tub. I can't get him out. He's 78 years old.
A frail elderly man has been found trapped in a bathtub. His best friend is now on the line.
Now he's complaining his head hurts, which means he may have fallen.
I'm organising help for you now, so stay on the line. I'll tell you exactly what to do next.
99, received that, thank you.
Intensive care paramedic Glennis is on her way.
If he's been there since yesterday, he might have some sort of exposure issues. Is he completely alert?
Yeah, but he's not coherent.
I hope they've kept topping up the water with hot water. Hypothermia is clearly a problem with someone who's been immobile in a bath and undressed for a long period of time. I've thought about that myself, you know. You're in the shower and you think, I feel a little bit of faint. If I ever had to call the ambulance, I'd say, dress me, put me in my full clothes, get the hairdryer out, do a little bit of my hair, put a little bit of mascara on me, and then call the ambulance. Here they are. Response 99, could you mark me arrived, please?
There's no way of knowing what's wrong with this man. I don't know whether he's been topping up the water and keeping himself warm or he's absolutely freezing. The consequences could be quite catastrophic.
There's 4 days' worth of newspapers here.
With unopened newspapers on the front porch, it now looks like the man could have been trapped for up to 4 days.
Is he in water?
Hello? No.
He's dry. He's bone dry. So if he was in a bath,
Yes.
he's obviously been out of the water long enough for him to dry by the environment.
Are we covered?
Dan just brought him some blankets.
Dan?
Yes. His mate.
Dan, who discovered John in the bath, is still shocked at finding his good friend in such a heartbreaking predicament.
I tried 13 times to call John, so I only lived 10 minutes away. I came down to check on him. I have a key to the place. I unlocked the door and found him in the tub, shaking and scared. He has a bit of dementia. He's not real lucid all the time. You know, he forgets a lot of things.
With the traumatised John unable to tell them what happened, the paramedics need to get him out of the bath urgently to assess his injuries.
No head strike?
He's complaining of head pain. But
Give
I
him-
haven't had a good feel
All right.
yet, just because of the position he's in.
Yeah.
There's a couple of problems with him being in the bath for a long period of time. He could have hypothermia. He hasn't moved those joints in 4 days. So when we start trying to get him out and pulling on his limbs, he will be in significant amounts of pain. Clearly this man could be in a bit of strife.
It's a beautiful day to be hanging out with my Tasman.
Aren't you lucky?
Paramedic besties Taz and Amanda are waiting for their first case of the day.
Lucky lady.
Where else can you find a partner like me?
1 in a million, Taz. 1 in a million. How many people are there in India?
1.3 billion.
So are you 1 in 1.3 billion as well?
Yeah.
Okay.
I'm a limited edition.
Limited edition.
Yeah. When God created me, he only made one of Taz.
Only 1 Taz.
The one and only is now on his way to a job at an unusual location.
All right, Tazzy, we've been dispatched code 3 to a 65-year-old female who is at a cemetery who has fallen and injured her shoulder. Do you know people that live in Springvale can't be buried in that cemetery?
No?
No.
Why not?
Because they're alive.
Good one. Good one.
Amanda's jokes? Terrible. I think Amanda should leave that part to me and she should just concentrate on doing the paramedic job.
Quiet neighborhood.
Hello.
Hi, how you doing?
Good, how are you?
So he's going to escort you.
Oh, beautiful. A VIP escort.
I want to ride that.
I feel like the Queen.
As Taz and Amanda pull up, A single responder is already on the scene.
Yeah, it looks like they've been at a funeral.
The patient, Katerina, took a tumble, and paramedic Dave thinks she's dislocated her shoulder.
Push up with those legs. That's a go. 1, 2, 3.
That's it?
Push up. Sit.
Oh, it's a bit sore, is it?
Yes.
Pain relief has already been given, but the patient will need x-rays at hospital.
I'm feeling sorry for this poor lady. You know, she's had a pretty average morning attending a funeral, so it's not a very nice end to not a very nice day.
I've never been in an ambulance. This is interesting.
Well,
There's always a first
that
time.
one off the list. We get her in the back of the ambulance and she's really finding it hard to find a comfortable position. You think hanging is the way to go?
I think at the moment.
If that's what's comfortable, then that's what we'll go with.
Can I hold you?
Absolutely you can, no problem at all. So I start to talk to Katerina, try and distract her from the fact that she's in so much pain, just get to know her a little bit. So I asked the question. So I suppose you don't really want to talk about it, but whose funeral was it? And then I heard a story I'm not likely to forget anytime soon.
Very interesting. I had a car to be fixed.
Yeah.
And it was with my mechanic for 3 years and the bugger didn't get on with it. Then he died on me. And that was his funeral.
Am I hearing this right? She's come to a funeral to find out where her missing car is.
Response 99, I'm en route.
Single responder Cam has just started his shift with a job that all paramedics dread. A toddler who appears to be unconscious.
We're being sent to a 15-month-old female that we believe might have had a seizure after a head injury, so could be complex. Children are always scary because often they can't tell you exactly what's wrong. There is another ambulance on scene. They've done a brief assessment and they're requesting an intensive care unit. First priority is to calm the scene. Often with these scenes, you've got parents that are a little bit elevated as well. So we'll see if we can just get on top of that and then find out exactly what's happening. Response 99's arrived. G'day.
How are you? Mum's inside.
No worries. Hello.
Hello.
I'm Cam.
This is Jess and
Hi.
Isabel.
Hi, Jess. Now, we got a story that she might have been kicked in the head, or was it just from the fall?
She just, a little boy jumped off the ledge. It would have been this height near ground, and his foot just hit the side of her head. Literally within like 20, 30 seconds, she started having a seizure.
Okay. Do you want to lie Isabel down here, and then we can have a little look at her? Did she go really stiff and then start shaking?
Started
rolling back.
And her jaw started going side to side.
Yeah. And then afterwards, has she just been like this the whole time?
Yeah.
This would be awful for any parent to witness.
Hello, honey. Hello.
We have a period after a seizure that's normal to be in an altered conscious state or possibly unconscious. But after that, you expect to see signs of waking up and movement. So the longer somebody stays unconscious, the more I'm starting to think, is there something else going on? Isabel might have a possible brain injury.
She feels really warm on her head, like she feels warm.
Isabel's mum, Jess, is managing to hold it together, just.
She's never been sick, never had any seizures before. Her nose and her lips started going blue. She was just grey all over. She wasn't moving. I thought that she was probably dead and that we'd have to give some rescue breaths and start CPR. So it was really terrifying.
Hey, little miss. I'm just going to try and wake her up in a tick, and if she doesn't wake up, then I'm going to get the other guys to give me a hand. Hello?
Often after a seizure, people have a degree of unconsciousness, but now it's time to wake her up and see if she really is unconscious, or she might just be tired after such a traumatic event.
She might not like this. Hello? Little miss. Hello?
I had a car to be fixed.
Yeah.
And it was with my mechanic for 3 years and the bugger didn't get on with it. Then he died on me.
At the Springvale Cemetery, Amanda can't believe the story she's hearing from her patient, Katerina.
I think it's absolutely incredible that this woman is cheeky enough to turn up to her mechanic's funeral to find out where her car was. They say truth is stranger than fiction. You could not script this.
It's locked up and I needed to meet all the people. So no,
where my car is.
Were you friendly?
Yes, I've known him for 10 years. He was a decent guy.
Yeah.
Ready to go?
Yeah, I'm good. I'm good to go.
It looks almost certain that Katerina has dislocated her right shoulder after falling over. But she's still chatty.
I'm 82.
Are you?
Yeah.
You're 82?
82.
Are you sure?
Positive.
You look fantastic for 82.
I was 79 when I retired.
79? You're just a go-getter, aren't you? Look at you. Do you know the information came through on our screen and it said that you were 65?
Yeah?
Yeah. So there you go. Somebody else thought you looked young too.
What a stupid thing to do today, to go to that funeral.
Yeah.
Need to put a curse on me.
Look, I don't think you've done anything too sinister, so we'll see.
Here we are.
We're here. That went fast, didn't it? Time flies when we're having a chat.
Katerina will now be x-rayed to find out just how much damage she's done to her shoulder.
Just a couple of bumps, okay,
Oh,
Kate?
don't drop me.
We won't.
Behind the closed door in the back of the ambulance, we hear strange stories all the time. But this story is going on the top of the list.
Okay, let's go.
Hey, little miss. I'm just going to try and wake her up in a tick, and if she doesn't wake up, then I'm going to get the other guys to give me a hand.
It's been more than 30 minutes since baby Isabel was accidentally kicked in the head and suffered a seizure.
Hello?
Micah paramedic Cam is worried about just how long it's taking the 15-month-old to fully regain consciousness.
I just need to see if she will rouse to a little bit of painful stimulus. So I just give her a little squeeze on the nail bed. It's not something that I want to do, inflict pain on her, but I need to see if she's going to wake up.
Here we go. Oh, no. I'm sorry. I'm sorry.
And she does, thank God.
This would be full on for her to wake up to this, obviously. Hello? Hello?
This must be very overwhelming for her. Last thing she knew, she was in the playground having fun, and now she's waking up to some ugly monster with a beard and a bald head peering over the top of her. She's hooked up to all this equipment in a strange environment.
Hello, miss. Is she normally pretty good with other people?
Yeah.
So you going to be all right with me lifting you up? There we go.
Isabel's been such a good little girl. She's letting me hook up probe equipment to her feet to measure her oxygen levels, and she's strapped in. At the moment, I'm happy to just take her to hospital like this. She's been great.
Oh, come on.
Then she starts howling.
Are you not happy? Well and truly awake now, obviously. I'm right to go, mate. Thank you.
Medically, I'm not worried about her anymore.
I know.
But she's downright disgusted to be in the back of an ambulance.
Normally we get a little teddy bear in the trucks, but they don't have one. I'm no balloonist, let me tell you. Here it is. Here it is.
I'm doing my best to try and entertain her.
Do you want to play with Mr. Balloon? Here you go.
Nothing's winning. She is over me.
Do you think she'd settle a bit if you were here?
So I asked Mick to pull over so I can get Jess to sit there and reassure her.
Okay, thanks, Mick. Good on you. I don't think she's going to like anything at the moment. Tell you what she doesn't like, the back of an ambulance.
I might have left it a little bit long for even Jess to calm her down. She's worked herself into such a state.
You know what? Here we go. Go for it.
There's only one thing she needs now, and that's a cuddle from Mum.
Oh, is that it? Is that what we needed?
Isabel is finally happy. But Jess won't stop worrying until doctors test her daughter and hopefully give the little one a clean bill of health.
She's been an angel the whole way here, mate, like this.
And so he was naked though. But he could have fallen in there, couldn't he? He could have slipped in and fell in.
Single responder Glennis and a team of paramedics and police are trying to get their terrified patient out of his bath.
I'm thinking if you fell into a bath, you might fall the wrong way. If you're actually taking a bath, your head would be at the other end, away from the faucet.
78-year-old John lives alone and suffers from dementia. Sadly, it appears he could have been stuck in the bath for up to 4 days.
We're just getting the door off, mate, so we can get to you.
This must be really confronting for John. He is naked inside a bath and he's got people all in his tiny little bath.
Who found John is anxiously waiting for news about his mate.
You right down there, John?
We just want to get you out safely, mate.
I am worried that it's taking so long.
Do you want me just to quickly Google how to take the screen off?
He looks like he's in shock because he's shaking, he's incoherent, and, he's just very white. He's lost the color.
Oh, look at you.
We haven't wrecked it, mate.
John's super scared. So it does take all our best efforts to keep him calm and relaxed and try and show him that we're here for him today and that we will look after him.
Well, let's get him up first.
Manual handling expert Bruce has arrived with specialist equipment to lift their elderly patient out safely.
That's it, buddy. That's it.
You going all right, John?
Yes. We've got you.
If I hadn't checked on John today, there is nobody else. He would have just passed on in the tub. What a way to go. It's tough. A good friend.
Just
All right,
to
mate.
test us.
Let's get you out of here. Backwards.
Every time I walk in, he goes, I got a bone to pick with you. Where have you been, Because he hasn't got anybody else to come see him.
Backwards. Wasting our cat.
You got a cat?
Yeah.
John was really reluctant to come to hospital with us after we got him out. He was worried that who would be there to look after his cat.
I don't want you to worry about Princess. I'll take care of Princess, okay? I'll make sure she's fed and watered. Seeing John like this, it makes me see life in a little different manner. That could be me laying there.
You're right, here, grab onto me.
And to see somebody that you've known as long as I've known John, just hurts. Just, it's not fair.
Push. Oh.
Wow. Here we go.
Okay? I'll take care of the cat. I've told him that if he goes into a home, I wouldn't take care of Princess, but he still wants to take care of Princess. Princess is his life.
Hello, lovely. Hey. Oh, you're well fed.
So do you live there by yourself?
Yeah. He's so frail. It's a big concern as to whether he makes it through this.
See you when we see you.
Not long to go now, huh?
It's getting pretty close. I'm getting scared and excited, but mostly scared.
Yes.
It's the start of night shift for Nat and Leonard, and they're talking babies. Leonard's about to become a dad for the first time.
You should be scared and excited, though.
You should be telling me that things are going to be okay.
It's sleepless nights, it's crying, it's nappies, it's vomit, it's
But
poo.
on Instagram, all parents look happy. Is that a total lie?
Yes.
But the teasing stops when the team is called to help a driver who's lost control.
Emergency services, tell me exactly what's happened.
A car's veered across the median strip and just gone straight up onto the embankment on our side of the road and into the bushes. And we can't get him out of the car. We believe he's having a fit in there.
What makes you think he's having a seizure?
We could see him shaking around in there.
Don't move him unless he's in any danger, okay?
It states as a car versus bushes.
Okay.
You know it's a male and possibly having a seizure. They're trying to get into the patient. So I can only imagine he's trapped inside the car.
Okay. So whether he's had the seizure that's caused the car accident or whether he's had a car accident that's caused the seizure.
Yeah, which would be extremely serious
We
either
don't
way.
know.
But I'd be really concerned about obviously traumatic head injury. I can't say anything just yet.
I can see some... I'm having a bit of difficulty actually finding the car accident. Usually we have a waiver that beckons us, but tonight there's no one around.
Is that it?
Oh yeah, you're right, there's light.
Now that's going to be hard to get into.
Oh wow, he's actually in the bushes.
Caller unable to get into patient.
Yeah.
Vehicle still running.
Okay,
Very
we've got to
odd.
be careful, don't we?
Yeah, we're going to be really careful here.
As Nat and Leonard approach, they can see the crashed car is nose deep in thick bushes metres off the road.
Where's the caller?
Just gonna have a quick look.
I think we get the fireys.
Let's get the fireys. Hello? Hello, can you hear me?
The engine of the car is still running. This is a really dangerous thing. At any given moment, that car could take off or even reverse onto me.
Can you turn the car off?
Turn the car off.
I'm really worried it's going to reverse.
Yeah, I know.
Can you turn the car off, sweetie?
Turns out the driver is a she, not a he. And she is not responding.
I'm just a bit worried. She's going to hit the accelerator. Don't get out there. Turn the car off first.
Hello? Hello? Can you turn your car off?
What a day. We've done nothing. I'm really disappointed. What?
You're going to have jinxes with an hour to go. Now settle down.
Right, okay.
Easy, tiger.
Settle pedal.
Tonight, veterans Glennis and Dodsey have teamed up, but so far, it's been uneventful.
Now we're all yawning.
I met Dodsey about 17 years ago and I said, what would I have in common with Dodsey? He's covered in tats, he looks like ZZ Top, but I have never been proved more wrong in my life.
Oh, I'm yawning now.
We have a special bond, me and Glennis. We've shared a lot of things over the years, you know. She's my ambulance crush. I love Glennis.
If I fluff them, will they come up?
Dwee!
Oh! Hello. Breathing problems. 62-year-old short of breath. Could be an arrest.
As Dodsey and Glennis head lights and sirens to the Code 1 case, the distressed patient is still on the line to the Emergency Communication Centre.
I got grease.
Okay, are you there by yourself?
Yes.
Do you have cold sweats?
Yes.
Okay, I'm going to stay on the line with you until they're right there with you. So if anything changes, you just let me know, okay?
You are clear left.
All
Clear on
lanes.
5.
Thank you.
So being breathless could be anything from having fluid on the lungs to a chest infection, or potentially it could be someone's heart's not working and the fluid's backlogging into the lungs.
Hi guys, I'm Glennis, this is Paul. Let's see what's happening.
I haven't quite got any words yet.
When Dodsey and I walk in, the other crew are already knee-deep in it. What we're greeted with is a man who's grey. This doesn't look good. He looks like he's about to arrest.
What's your first name, mate?
Ivo.
All right, no more.
This man couldn't really talk to us, so we couldn't get a lot of history from him. I can hear that his breath is rattly and the heart's not pumping blood forward, so I think there's a lot of build-up of fluid in his lungs.
Have you got any pain anywhere? Have you got any pain in your chest?
We think this man's having a heart attack and he can't breathe. He's really sick. We don't have a lot of time. We need to move quickly.
All right, you're right.
Just breathe in and out, okay?
Hi. We just worry she might hit the accelerator and the car actually may go backwards.
At the scene of a bizarre accident, Nat and Leonard are concerned the trapped driver may have serious injuries.
She's in the front, looking a bit dazed.
With the car engine still running, it's too dangerous for them to approach.
You've organised a tow, have you?
Yeah, the police are organising a tow.
More emergency services are arriving to help get the driver out of the badly damaged car.
G'day, mate. Got one patient. We're not too sure why she's kind of veered off the road. Yeah.
And the car's off now, isn't it?
It is.
With the engine now switched off, Micah Paramedic Shannon can assess the patient before they move her into the ambulance. But suddenly, the woman opens the car door and gets out. She's dazed and struggling to stand up.
She's not really sure what is actually happening, but then she turns around and I see this massive bump on her head.
I recognise the patient.
Do you?
If this job wasn't already strange, it gets even weirder because I quickly realise that I actually know this patient. She works at a hospital that I frequently visit and hand over to.
Hi, love. We're going to pop you on here.
What was her name again?
Anouk.
Anouk.
Hello, darling.
Hello. Do you want to have a seat over there?
She works at the hospital.
Can we get you into the ambulance away from all the lights where we can talk properly?
That's all right.
I've got your bag. You've been involved in an accident, darling, so let's take a seat and we'll talk inside.
Have a seat. That's it.
better.
There we go.
You had an accident driving home.
She's obviously confused, disoriented, not sure what's going on or why we're even there. I'm starting to worry that there's something really serious going on with this patient.
So what's my car? That's your car. Anything wrong with it? A couple of scratches. Where? Just on the outside.
Do you have any pain at all in your chest? Have you had fluid on your lungs? Have you been to hospital with this before? Nothing?
Glennis and Dodsey are almost certain their patient is suffering a major heart attack. He's finding it so hard to breathe, he can't even tell them his name.
He is terrified. You can see it in his eyes. His body has shut down all the blood vessels to his skin and they're trying to drive the blood back to its brain and the heart. He is not a well man.
You've never had heart troubles?
62.
We think this man's having a heart attack, so we need to get those ECG dots on. Problem is, he's sweating buckets. So we're just trying to get a trace and see what fundamentals we have or what baseline ECG we have.
Wouldn't mind a little look at that ECG. All right.
Left bundle failure.
The readout confirms the man is having a heart attack. He could be close to cardiac arrest.
These I'm just putting on just in case.
His heart is failing. It's not pumping the blood forward to the rest of his body as efficiently as it should, which means the blood backlogs up into the lungs. So this man would be feeling like he's drowning.
All right. How long have you been short of breath for?
Well, I noticed in the afternoon.
Yesterday afternoon.
After being put on oxygen, the man's finally able to get out a few words.
When I went to bed.
Yep. You lay. Yeah.
I couldn't breathe.
All right.
This man is the sickest I think he's ever been. And if we hadn't arrived when we did, it would have been catastrophic for him.
I'm going to put this blanket over you.
With the patient so critically ill, his only chance of survival is getting to a cardiac unit.
All right. Yep, let's go.
Extricating him from the house is really quite difficult because we know that the heart is already under full load. So if he has any form of exertion, that could tip him over into cardiac arrest and he could die.
Do you know what's happened tonight? No.
Leonard and Nat are examining the dazed Anouk. She's just veered off the road and crashed her new car.
Were you driving to work or from work? Because you look like you've got your work clothes on.
I do.
Do you reckon you're on the way to work tonight?
I don't know.
Not sure.
The fact that she's got such a large bump on her head and that she's so confused makes me really concerned that she's potentially got an internal head injury.
Is there pain anywhere else on your head?
No.
No? Any pain on your neck?
No. I don't even know. My car's all right.
What we're going to do, and you probably know what I'm about to say, we're going to take you to hospital.
What do I need to go to hospital for?
Well, you've had a pretty major car accident.
They don't want to have my car. Destination. When a patient hits their head, the brain shakes around in the skull and they present with what we call retrograde amnesia. I wanted to check out my car.
No, we can't do that.
Why can't I put my car?
The car's not in a good shape. So this is what we're going to do, Anouk.
I don't want to have a look.
No. Anouk, what we're going to do, you'll get your car back, but we need to put a collar around your neck, and then we're going to take you to the hospital.
All she can focus on is what's happened to her car.
Just look straight up, Anouk.
Whereas we're focused on what's happened to you.
No, keep your head straight. You know what to do.
Anouk is a nurse at a local hospital, but that's not helping.
Look at the smiley.
Look straight up. Don't move.
The confused patient is not happy about having to wear a protective collar.
Let's go.
Let's go. Otherwise,
go.
worst comes to worst, I'll just have to take that off.
We're going to otherwise...
Because it's just irritating her.
I really want to sit in the car.
Anouk, you need to stay still.
The whole point of the collar is to keep the patient rock steady, dead still, to protect the spinal cord.
You need to be still, Anouk, you know that.
She doesn't want to bar it. She's looking around, she's trying to get up. It's just not working.
Anouk. All right, I'm taking the collar off.
Right. Good to go?
Good to go.
Too much distress?
Yeah, too much distress and
No worries.
irritation.
I sure hope I don't remember crashing. I would seriously love to know what happened.
To be honest, me too. But I think I have a fair idea that a medical event, whether it was a seizure or whether it was you blacked out for some other reason, has happened. Because, like you said, you felt sick, you wanted to vomit, you don't know anything about the crash, and the next minute, we're inside the car trying to get you out.
This is the worst day ever.
But Anouk's devastating day is not over yet. Leonard and Nat are concerned about just what doctors will discover when they examine the bewildered nurse.
I've still got so many questions. What caused the accident? Is there internal bleeding going on?
We're pulled into the hospital, so we'll get you straight in.
Anouk definitely had a seizure at some point. But what is the cause of that seizure and how serious is it? There's so much we need to still find out.
Guys, do you want to give him a hand down that end?
The pressure is mounting on intensive care paramedics Glennis and Dodsey. Their patient is having a major heart attack, but just moving him to the ambulance is risky.
We've got our CPAP.
His heart is quite vulnerable at the moment, so we need to move him in a nice, slow fashion, make sure that we get him onto a bed and not too much activity because it could lead down the pathway of him having a cardiac arrest.
Can I have my monitor?
You want yours?
The man is struggling to breathe and urgently needs more oxygen.
I'm just going to stick a mask on your face, OK? It's going to be uncomfortable, but it's on there for a reason. Glennis, can you hold this, please, whilst I put this on his head?
That's it. Nice breaths. Now, you sure you've got no pain? You've got no pain? All right. What's your first name?
Where's your wallet, mate?
The paramedics are still trying to find out their patient's name.
Here you go.
What is it?
Ivo? Perfect.
It is nice to finally find out what his name is, but Ivo's got a long road to get through. We've got to bring that blood pressure down. We've got to take the pressure off the heart.
That is ready to rock and roll. It is purged and ready to go.
Just going to pop this under your tongue. Don't chew that one, just let that one sit there, love.
The hospital is 10 minutes away. In Ivo's fragile state, every second counts.
So mask on, plenty of O2, got a bag up. He's had the drugs that we can give him.
As the medication takes effect, Ivo's breathing is gradually improving.
I want to have another listen to that chest of yours. That's it. Oh, good. I'll give you a couple, mate. That's it. How you going? Do you feel better? Good. Right, Ivo, we're here now.
The team has got Ivo to the Monash Medical Centre alive. Cardiologists are on standby to find out if he needs immediate surgery.
All right, let's get you inside.
Good outcome. Good job. Good job.
I did look at him first off and I thought, oh my God, yeah, he's having a big heart attack.
Oh, he had
and
heart
I thought,
attack written all over
if we
him.
don't get this line in quickly, he's going to arrest on me.
Hopefully they'll tickle him into the cath lab and have a look and make sure his ticker's doing all the things it's supposed to be doing.
Yeah. Oh, and the nursing staff took those pads off and put their lovely little small ones on.
Oh,
But
he got a free
wax.
chest wax.
Yeah. Poor bloke.
Ouch.
Oh, well.
We're going to a gentleman. He's sitting on the road. It says he's unable to stand up. He's possibly hit his head.
The busy night is continuing for Nat and Leonard. They've just been called to their second emergency.
Actually, it's just changed to a stroke. I think it's...
Yeah.
This is unusual, isn't it?
This is very unusual. Down an alleyway. Give me the thumbs up now.
Yeah, we'll just get the bed out though, Leonard. Are you okay
Yeah.
with that? Hi, buddy. I'm Natalie from the ambulance service. Have you girls called us? You just found him here?
Oh.
In my experience, stroke patients don't typically greet you with a thumbs up when you arrive. Have you been drinking?
No.
Can you see me?
No.
Do you want me?
Oh, no.
I've had some mixed reactions when I've asked men, do they want me in the past? But there's no mistaking this patient. It is a most definite no.
No.
Okay.
We don't think he speaks English.
Okay. You've been drinking a lot of alcohol?
Yeah.
All day?
Yeah.
Yes. We need to take you to hospital.
Yeah.
Yes? Excellent.
I love you.
You love me?
Wow, that's very quick.
He loves me.
So alcohol intoxication can actually be very dangerous.
I love
Can
you
you
too.
bend your legs? Because you need to stand up.
It's not as simple as just letting them sleep it off. You can end up vomiting and choking on the vomit and dying.
You need to get up and go over to the bed.
I want him on, yep.
How about you just do
yes.
that?
On
And you get on your knees and you crawl.
We're trying everything here, but nothing is working. One arm. On. It's like we're playing a game of charades.
I don't know.
Can you demonstrate what he needs to
To get
do?
on it in my knees.
Can you roll onto your hands and knees? We're all having a bit of a laugh, but at the end of the day, it's a cold night. We do need to get him up off the ground. You need to get up onto the bed. Do you understand?
Moving this patient is turning out to be anything but straightforward.
Careful in case he vomits. Vomit that way. That way. Drunk people can actually be harder to move than unconscious people. Not only are they a dead weight, but they can actually be quite resistant and combative to what you're asking them to do. Why don't we get the evac mat, roll him onto it and just slide him up, and then no one's lifting up. Hang on, oh God. He's too intoxicated to get up himself.
RC715, can we just get back up here? I've got difficult extrication.
The evacuation mat is a fantastic piece of manual handling equipment which enables us to safely move patients from the ground and onto the stretcher.
The backup crew has now arrived and Nat and Leonard can try Plan B.
Ready,
Your call.
set, go.
Oh, and the rain's coming too. Fabulous. There we go. Okay, thanks guys. Okay. I'm not Russian. Not Russian. English? Da? Small amount. Oh,
Let it vomit.
no, that's a hiccup.
Oh.
It's been a marathon effort to get the man into the ambulance, but they can finally start the short journey to hospital.
Blood pressure is up. Yes. Because of me. Me!
Yeah, because you're probably getting him all excited.
Settle down. We very often deal with intoxicated patients. Many of them are often aggressive or abusive towards us. So it's really refreshing to meet someone who's a really happy drunk.
Just a little bit drunk.
A little bit.
Little.
No, I think a lot.
Спасибо.
Thank you. I gotta thank you.
At the Alfred Hospital, the man will be closely monitored until he's well enough to go home.
He's probably gonna wake up tomorrow morning feeling pretty lousy, but at least we know he's going to wake up. It's a good thing those girls found him when they did.
Can I have vodka?
Can I have vodka? No.
Pop it in here, number one. We'll find number two. Where's number two gone?
Little Isabel has done a lot of growing since she had a frightening seizure.
Well done.
When intensive care paramedic Cam rushed to her side, she was still unresponsive.
Did you see the seizure? Did she go really stiff and then start shaking?
Started
rolling back.
And her jaw started going side to side.
Fortunately, tests at the hospital cleared the toddler of epilepsy or any other long-term medical conditions.
She's been fine, completely fine. Definitely hasn't had any more seizures.
Ready? Do you want to hop on the back?
Now, Isabel's only concern is keeping up with her twin brother, Harrison.
Ready? Beep, beep. I think we're very, very lucky that she's not sick and that it was just a one-off.
Come on, hop in.
She's just the sweetest little thing.
Whoa!
What's your first name, mate?
61-year-old Ivo was diagnosed with a major heart attack and spent 2 weeks in hospital.
These I'm just putting on just in case.
Several weeks later, he was readmitted. A blockage in an artery was removed and a stent successfully inserted into his heart.
That's your car.
Nurse Anouk was dazed and confused after her car suddenly veered off the road and crashed into bushes. Tests cleared her of any neck or head injuries, and she escaped with just a black eye and bruising.
I really want to sit in my car.
Anouk's much-loved new car did need some surgery, but has made a full recovery.
I've never been in an ambulance. This is interesting.
As for Katerina's missing car,
It was with my mechanic for 3 years and the bugger didn't get on with it. Then he died on me.
she's finally tracked down her wheels and has fully recovered from her dislocated shoulder.
He put a curse on me.
He could have fallen in there, couldn't he?
Terrified John was found trapped in his bathtub, shivering and incoherent.
You right down there, John?
We just want to get you out safely, mate.
The 78-year-old spent several days in hospital, recovering from exposure and the impact of his ordeal.
See you when we see you.
Knock, knock.
Dan, anyway.
How you going, bud?
John's now safe in an aged care home.
Yesterday was the first day I could walk.
You're moving along pretty good.
And the man who saved his life is a constant visitor.
I can't tell you how happy I am that he's in care and he's being looked after.
Hello, Princess. As for John's cat, Dan came to the rescue again, giving Princess a loving home.
You know who's playing footy tomorrow night?
Yes, in Collingwood.
Yep. You know, we're friends. And friends take care of friends. It's pretty simple. You've come such a long way. That was better than before you were in the tub.